Good afternoon. I'm Terry Scoggin, CEO of Titus Regional Medical Center, and today's Friday, January 15, 2021, and it's our weekly COVID-19 update. I want to start with the numbers straight up this morning. From a health system standpoint, we're sitting at 23, as the news stream comes up, we're sitting at 23 patients in the hospital today with COVID. 15 of those are on the floor, and 8 of those are in the ICU. So we are full, and that's what we were concerned about earlier this week, and we've hit back to capacity where we were. At the beginning of the week, when you look at the region, we've been at that 15%, 20% all week long. So on Wednesday, we were at 22.07% on the 13th, and we've stayed across that 15% since the 28th of December. So as a region, we continue to stay at those numbers. At the number we're at today, we have several waiting in the ER as well, so our ER is filling up on a Friday. So we're at the same place we were last week. So I thought we were seeing the light in the middle of the week, but we did not see that. So from a regional perspective, you can see where we are. As far as the numbers for the region, yesterday we finished at last night at midnight at 221 for the region, so about where we were the day before, staying in that 220 range. So over the last couple of weeks, we've dropped a little bit. I wouldn't say we're plateauing yet. But hopefully over the next few days, maybe we'll see a plateau for the rest of our region as well. The ICU beds at 78 beds with COVID is almost at our highest of 79. I am excited when I see 9 more staff beds. The state is providing strike team nurses across the region, and you can see other hospitals are doing what we can't do. Doing what Titus is opening up more ICU beds to take care of our community. So that's good to see. I was on the phone a few minutes ago with the Texas Hospital Association, and we were looking at the Dallas region is on that one. So it was interesting to look at the Dallas numbers. You can see Dallas from the earlier this week has plateaued for the last 4 days, and they're going down. The Dallas teams that were on talking about their estimates in their regions, they expect a plateau for the next 3 or 4 days. They're excited about that, and they're hoping that continues. All the numbers that they're seeing in the Dallas and Metroplex area shows those numbers continuing to plateau over the next few days. Now, they still are in the 25% for a region of COVID as a percent of total beds, so they're expecting to be above that 15%, they said on this phone call, for the next 45 days. So even though it's dropping, it's going to be quite a while till they get below that 15% of COVID beds. From a Tyler perspective, our friends just south of us, you can see at 640, they're maintaining. So similar results of our region in Northeast Texas as the rest of East Texas and the Dallas area. The one that I thought was interesting and I felt really bad about was at 163 beds is their peak now for ICU beds in the Tyler region. So as you can tell, from a Northeast Texas perspective, from Dallas to Tyler all the way up to the Arkansas and Oklahoma border, we're still battling this, and we're still can see COVID on every place we turn. The Texas Hospital Association, the call we have every Friday around the whole state, and then also members of the governor's team sit on that call and just give the updates. And the numbers they're seeing in Austin are kind of what Dallas is seeing. So they were excited to hear Dallas's numbers on the ground were portraying what their numbers in the computer were showing them and what they were seeing in their models. And their models do show a plateau, and they does show a directory over the next few weeks of going down. So we're hoping for that. All we can do is continue to follow the same precautions we've had. If you have symptoms, get to your doctor immediately. Make sure you get tested, quarantine yourself, make sure you're taking care of not only yourself, but your family and your friends as well. So just be smart as we continue to get further and further away from Christmas and New Year's Eve. We talked last night about the vaccine, the town hall, but we'll also just give you an update. We're sitting over 4,000 strong now on our wait list, and we grew 600 2 nights before just overnight. So we're as we get more vaccines, we will go through that wait list and try and get them distributed as fast as possible. We are following the state's guidelines, and they have specific guidelines for 1A, 1B, and as we get them, we're getting them out as quick as possible. We were notified a few minutes ago that we'll have another 400 coming at some point next week. So we're working on more software to be able to get those numbers out and get those vaccines as quick as possible next week. Our goal is to give as many vaccines that we receive out in 3 or 4 days so we can get the next week's shipment. If we can show the state that we're continuing and organized to get those vaccines out. We think we can get that number at least 400 to 500. My goal was to get 2,000 to 3,000 a week, but the 400 to 500 is what we've received for the last 2 weeks. 300 this week, 400 next week, but we'll continue. So I would encourage you to go to our website, titusregional.com, the red banner at the top where it says COVID-19 vaccine waiting list. We're going on that. And we're following the state's guidelines for the 1A and 1B of the different populations and different roles, healthcare workers and people on the front line in different jobs. And then now we're going to 65 and greater and focusing on that 65 and greater as well. So hopefully next week you'll get your sort of see a text or a voicemail. We'll try and contact you in both ways. I mean, at the end of the night, I will tell you, if you see a phone call from Titus around 4:35, if we have extra at any given day, we're calling people that are on that waiting list to see if they can come to Titus in the next few minutes. We will not waste a dose. So we are continuing to give those out as quick as possible. I've been proud of our team of how they've given them out so far. We've been more organized than some of other people we've talked to and be able to get those out as quick as possible. I want to give a couple shout outs and just thank yous. Channel 6, NBC News in Texarkana came and visited us last Friday. I did a story, so if you want to go to our link on Facebook and check out that story, or click on Channel 6 in Texarkana, their station as well. But she did a good story of rural hospital and rural healthcare, and really complimented what the team's doing here, and it showed some of the struggles that we're battling on a daily basis. And we've sent that to the state and also our contacts in Washington, D.C. As well, to support the story of the rural healthcare. Also want to give just a shout out and just a praise and a thank you to two great doctors who helped us last night. I had the privilege of participating last night in a virtual town hall meeting on the vaccine with Dr. DeLisi and Dr. Stagg. I will tell you it was a lot of fun. And just to have the opportunity to sit with those two and through the earphones, listen and watch them on the screen, the knowledge that both of these have, and the knowledge they've received from the medical staff and their peers and their research that they shared not only with me but Northeast Texas last night was impressive. We've had over 2,000 views as of this morning, quite a few shares. That information is being shared across the state with other individuals and regulatory and legislative agencies to see what we're doing in Northeast Texas. I do believe it's important from an education and a communication and giving the vaccine to get that information out to show the people who are making the decisions in Austin and in Washington, D.C. that give those vaccines to Titus and we'll get them to the right people. So appreciate the two doctors last night and the team here at Titus who put on that show. We'll do it again. And it may not be with vaccines. We'll look at some other service lines or some other things that we want to focus on here at Titus and bring those doctors and their expertise directly to you in the community. Again, on Monday, we're going to take the day off Monday from a screening. We have some commitments here and some meetings that we'll have to attend. So don't want anybody to get off our normal schedule and don't do it Monday and people think something's going on. No, we're going to take Monday off. We'll go back Wednesday and Friday and continue Monday, Wednesday, Friday the following week as well. But we have some commitments that we need to take care of on Monday during the day. So on behalf of the team here at Titus, I want to thank you for the support of our health system. Thank you for everything you do for us. God bless.